Good morning. It's 8:40. I'm Rick Sinclair. A couple of guests in C106.1 studios. You know, our C106.1 business of the day is Heartland Spine. Dr. Frank Hayward. How are you, Dr. Hayward?
I'm doing good.
Yeah,
thanks, Rick.
Glad to have you in this morning. And we got a special guest, too. This is Hazel. Hazel is, you're a patient of Dr. Hayward's?
Yes, I am.
Hazel Powell, is that
Hazel
right?
Powell, yes.
Yeah, where are you from, Hazel?
Southern Illinois, Perks, Illinois.
Oh, Perks, Illinois. All right. You know, Dr. Hayward, I got to tell you, first off, and it amazes me anymore how this is done. And I'm going to pick on doctors here real quick, okay?
Dr. Hayward.
I'm going to pick on doctors. And I want to tell you, true story. I have been trying for the last 2 weeks to get to talk personally with my wife's doctor. And you know, it's easier for me to talk to a senator of the state of Missouri than it is for me to talk personally with my doctor. So I'm going to pick on doctors why it's so doggone hard to get to talk to your doctor. But then you walk in here and you guys are hugging and almost kissing. You got such a good relationship with your patients. It's easy to get a hold of you.
That's very important. Yes.
Well, I think it is too, you know.
It may be hard to just call the office and say, can
I
I
talk to the doctor?
Hayward?
Sure, yeah.
I'll return the call within a day or two.
Yeah, and I understand how that is. Well, now, how did you get acquainted with Hazel here? You know, because she's been talking real highly of here, Dr.
Well, Hazel came in through the ER. She had a very rare condition where the blood vessels that surround the spinal cord ruptured. It's almost like an aneurysm of the spinal cord.
Oh, my goodness. Hazel, I asked you a little while ago, I said, what, were you in a car wreck? Because, Dr. Hayward, we see a lot of times spinal injuries that as a result of an injury, a wreck, or a sports injury or something, right?
Yes.
Hazel, yours wasn't, though, was it?
It was not. I didn't even know it was there until I started having back pain.
So were you just having a normal life? You were walking,
Yeah,
running?
I used to walk 6 miles a day and ride a bicycle, you know, all the time.
Oh, my goodness.
And play basketball and all that. But then all of a sudden, I was just like it just hit me.
Dr. Hayward, we've talked many times about how to protect the back, what we should do in our daily activities, working, you know, and how to do that. How do we protect against a ruptured blood vessel on your spinal cord?
You can't.
That's just something to just have. But, you know, when God says it's time for you to make a change in your life, then that's when it happens.
Yeah.
Wow.
Unfortunately, there's not much we can do.
Yeah. So you saw Hazel as a result of an emergency room entrance. Is that right?
Yes.
So what's been the challenge, Dr. Hayward, that you've seen here? Because that's not the typical situation.
Well, the challenge lies within Hazel. Mm-hmm. The challenge is Hazel being able to push and drive herself to get back to who she was, a more normal life. Yeah. Hazel's she started out in a wheelchair, correct?
Yes, sir.
And then you went to the walker, the four-pronged walker. And I'll let Hazel talk more about her progress.
Then I went to the canes. Then...
Oh, wow. Now, if I'm not mistaken,
Hazel...
Hazel...
crutches. Then I went to the canes in January.
However, somebody told you, did I hear you say a little while ago they said you'd never walk again?
Yes.
Who said you wouldn't walk?
The doctor here in Illinois, coming every day, you'll never walk. And I said, are you God? He said, no. I said, well, you don't know me. I'm determined to do it. I mean, if I set my mind to do something, I'm going to do it, and nothing's going to stop me.
Dr. Hayward, we see this a lot, don't we, where someone will say, or a physician may say, well, you know, maybe they don't have the experience, and I don't mean to be putting them down, but they'll say, well, you're probably never going to walk again, but it's determination is going to be part of the recovery process.
Yeah, I try never to do that.
Yeah.
It's not my decision to make in most cases. Mm-hmm. You know, and all you do is you still the patient's hope.
Sure.
And you know, you'll set up a self-fulfilling prophecy. You know, the patient will say, well, I can't walk and I'll never walk, and they won't try.
Sure, yeah.
So
what's the use? They kind of get that mentality. Yeah, Hazel, you were in a lot of pain? Is that
yes,
what?
when I didn't know when it happened, I was in a lot of pain in my back, and I thought, well, I can walk it off. I mean, I'm tough, you know, I can walk it off. The more I walked, the more it hurt.
Yeah.
I knew something was wrong.
And you went to an emergency room.
Mm-hmm. Yeah.
And then you got acquainted with Dr. Hayward here.
Yes, sir. Mm-hmm.
Wow. So what has been going on since did you actually have surgery?
Yes.
You did?
Yeah.
What's been going on since then? You said you've gone from a wheelchair to a walker and a cane, so you've had physical therapy?
Yes, in St. Louis, the rehab institution of St. Louis. They, when I started walking on my canes, it was in last month, and I thought they was holding on to me while I was walking down the hall, but I was walking on the canes by myself. I was walking 4 3 475s in the morning and 2 475s in the afternoon. So,
Oh, wow.
I mean, I'm up and down there before even the therapists get there. So.
Now, you're in St. Louis with your therapy.
Yes.
Dr. Hayward, are you in touch with these therapists and say, are you treating my patient the way I want her done?
Well, they send notes, but I touch base with Hazel, and she'll come in every now and then and let us know how she's doing. And Hazel knows that if someone's not treating her right, I'll call that doctor up or that rehab place up if I have to.
Sure.
Because I did about 10% of the work, and Hazel did the other 90%. And I'll do whatever I can to support her.
Sure.
To help her.
Well, yeah,
achieve her goals.
Hazel knows her own body. She knows her own limits. Of course, she seems like a tough little gal.
She is tough.
How about pain? Are you still in pain, Hazel?
Not as much. Not as much. I still have, like spasms in my back, but not as much.
Yeah. Oh, sorry, myself. I just told Hazel. I
Yes,
said,
you told me to turn my cell phone
And I
off.
turned mine off, too.
Yes, you told me to turn
My
mine
cell
off,
phone
Dr.
was
Hayward,
on.
and he's got
I'm
his
sorry.
on.
Can I turn mine back on now?
Yeah, can I turn mine back on?
I'm sorry. Mine, and I have Ozzy Osbourne's "Crazy Train" is my cell phone. Hazel, let's talk a little bit about your relationship with Dr. Hayward. You guys come in hugged right off the bat.
Oh, man,
so-
I love Dr. Hayward, and I love all his staff and everything. He treated me good. Like I said, you treat people good the way you want to be treated. You treat somebody right, you want to be treated right, too.
Yeah.
And that's the reason I fell in love with him. And actually, if it hadn't been for him,
We don't know where you'd be right
No.
now. Well, they already told you weren't going to be walking anymore. You have his office phone number on your cell phone.
Yes.
And I'm going to tell the truth here, Dr. Hayward. She was calling your office here, about 10, 15 minutes ago, and I don't know who was answering the phone. Do you know?
some man answered the phone.
Okay.
Craig.
Oh, was it Craig? He said, you know what? He's on his way. He'll be right there. And she knew exactly where you were. That's very rare, Dr. Hayward. And just from the experience I've run into trying to talk with my wife's physicians, you just can't. That's you just don't get to talk to your doctor anymore, doggone it.
It's worse than an attorney.
Yeah.
Yeah.
Well, no, I don't know. I can talk to an attorney easier. I can talk to my banker easier, but I can't talk to a physician. So I think, Dr. Hayward, you're an oddity anymore of the relationship you have with the patients. And I know we've talked many times. It's because that's how you like to be treated.
That's true. I don't want my doctor
Avoiding?
inaccessible or avoiding me. And, if I have questions, I want them answered.
Okay.
So.
Hazel, it's been a treat having you in
Thank
here
you.
this morning.
And another thing, I'm close to my doctor in St. Louis, too, Dr. Volstein. I mean, if I call on the phone, she call me back, what's the problem and all that. So it's good to have a good relationship between your physicians. And Dr. Hayward and Dr. Volstein are the two best physicians I've ever had because we are close.
Dr. Hayward, did you make that referral there to a physician that you knew, or how did that relationship work?
I'm not certain. Hazel, did we make the referral?
No,
or did Karen-
my doctor up here in St. Louis made the referral
I got
at
you.
the clinic to Dr. Volstein, so
Okay.
yes.
Okay. But you're working real close with anybody because you still follow up with Hazel,
Well,
don't you?
every now and then Hazel will come by. For the most part, I'm not following up with her regularly. Dr. Volstein, her doc, and her is it your family doc in
Yes.
St. Louis, is doing most of her care. I'm here. If she needs me, all she has to do is call the office, and we'll take care of anything we can.
The injury I say injury, the condition that Hazel had, Dr. Hayward, and I know you can't open up a magic window and say, here's exactly what would have happened, but without proper medical care, what would have been the prognosis ultimately? Could she have lost the use of her leg completely?
She could have.
Total paralyzation?
She could have, yes. And if it happened higher up in the spinal cord, she could have died.
Goodness
If it
gracious.
happened in
Oh,
the
my
neck,
goodness.
she could have
Yeah.
died or
That is, that's awful to think that,
lost the use
something
of
like
her
that.
arms.
Yeah, so it was getting the right diagnosis and then the medical care as quickly as possible.
Yeah, it was my first time ever treating anything like this. It's very rare. It doesn't happen often, and it turned out very well.
Well,
it could have been a lot worse.
Sure. You say very rare. When I asked Hazel, I said, so what was it, an accident or something? That's typically what you see, injuries as a result of improper, lifting or something. Is that what the major of your patients do?
Patients that are injured at work, motor vehicle accidents, or just walking around. And
Yeah. I've hurt my back one
over,
time sneezing.
Yeah.
Yeah.
So Getting out of bed.